the first 12 months to possibly 18 months, you do have a testosterone surge in children. And so you will notice that the penis kind of grows a little bit more than usual. And then after that, the penis kind of stays dormant until puberty, when testosterone starts circulating and all that. And so from, maybe at 12 months to 18 months, depending on which data set you believe, penis will actually only grow a little bit each year. So don't be concerned if your child's penis isn't growing the way it is in puberty. Once puberty hits, then testosterone starts circulating, and that's what we refer to the Tanner stages. And then you'll notice the penis will just psh. And usually penis is genetically linked, so whatever dad size is, typically the kid size will be the same, with some exception, nutrients and what I mean by that is, if you have poor nutrition, then just like with everything else, you probably won't grow as well. Versus if you have good nutrition, then you'll grow well. So just like my partner, who's also my younger brother, is 10 years younger than me, I'm 5'7" 3/4. He's 5'11", almost 5 feet. The only difference is he was born here, and so I had rice milk, which probably has zero nutrition, versus he has whole milk, which has a lot of nutrition, and so that's why he's tall. As far as down there, I have no idea his length. So I never really asked him, but I do know, he is probably gonna be different because of nutrition.
We gon' do it like it's priceless, take it to the moon. Priceless, one day will be soon. Like it's priceless.
Hey everyone, it's Dung Pham. This is our second episode, and so I've been getting a lot of messages on Facebook Messenger and all that, asking to discuss different topics. And one of the topic that everybody kind of is interested in is penis elongation. So let's clear up some misconception first. There seems to be this misconception that, well, it's just a suprapubic fat pad. And so what I want to do today is kind of clear up some misconception and then kind of talk about penis elongation, penile enlargement, which is two very different things. And a lot of guys or parents, sometimes they don't, they think both are the same when really they're not. And then we'll go into kind of risk benefit, complications, stuff like that. But one of the biggest thing, or one of the most common thing I've seen, is parents would come into the clinic, or patients would come into the clinic because they would go see their primary care doctor, who basically the patient has buried penis, and which is very different from micropenis, and we'll talk about that too. But they would come in and then they would wait years because the pediatrician or their OB or whoever the doctor is, the internal medicine, whoever it may be, would tell them, oh, you just have some fat there and you'll grow into it. So the penis is not like a pair of shoes where you actually can grow into it. The only way that the skin on the penis can grow is you have to stimulate it to grow, just like with anything else, like obesity. If you eat a lot of food, eventually your skin will stretch, and penile skin is no different. And so unless you put it on stretch, i.e. with surgery, you will never get the skin to grow, and it will grow into proportion. So you'll never grow into it. It'll look the same. Now, obviously, if it's just a little bit of, because hidden penis spectrum is very wide, obviously, right? And so if your hidden penis is very mild, then I agree. You don't really need to fix those, leave those alone. But if, 2, 3, 4, 5 years and the penis still looks like a belly button, well, then more than likely we have a problem. And I'll go into why you fix buried penis or hidden penis. It's not really cosmetically driven. Cosmetic is just a secondary, if not tertiary, benefit. And so with the buried penis syndrome, usually there is fat associated with it. But I see a lot of guys that they don't have any suprapubic fat. They're like fit, muscular guys who basically their penis looks like a turtle head. And so the traditional thinking, and I don't know where this even came from, is, well, let's just watch it, it's baby fat, or, go work out. And I have a lot of guys that they listen to that advice, they go work out, they get plastic surgery, and then their penis is still short. So the only physical way to make your penis longer is you physically have to move it from point A to point B. And we'll get into that here in a little bit. But suprapubic fat pad, all that does is really, it's an illusion. It's like a David Blaine urologic version. And what I mean by that is if you're heavier set, or the child's heavier set, 10th grade, 11th grade, whatever it may be, the penis size is still the same. You just push that fat pad back, take out the measuring tape. If it's 2-inch, then it's 2-inch. If that patient goes work out, get plastic surgery, whatever it may be, and get rid of that fat, it's still going to be 2-inch because you physically have not moved it from point A to point B. And so when you have buried penis, a lot of time insurance will cover it for the reasons where I'm going to go into right now. It's A, if your penis is sunken down and you're circumcised, what's going to happen is the skin is going to stick to the head of the penis, or what we call the glans penis. And if you don't constantly pull it back, eventually that skin will form what you call penile adhesions. And penile adhesions will start out as soft penile adhesions, which means that you can still pull it down. It's a little painful, but you can still pull it down. However, if you leave it for X amount of time, and the reason why I say X amount of time is we don't have any data to show, is it 1 month, 2 months, 3 weeks, 2 days, 5 days, because everybody's different, right? Once you leave the skin and it actually forms into or grows into the head of the penis, now that's what you call skin bridges. And with skin bridges, the only way you can get rid of it is surgical, because you can't peel down the adhesions anymore because it's no longer soft, and what we call manipulation of foreskin. And so there's no debate. The head of the penis is supposed to look like a mushroom, period. There's no, it can look a little bit like this, can look a little bit like, no. Penis is one of those things where it's hard to describe, but when you see it, you know it. And penis is supposed to look like a mushroom head. And so when I do circumcisions on newborns, I always have patients watch a video to tell them when to start pulling the skin back, because the penis, a perfect penis, consists of the head of the penis, called the glans penis, and then below there you're going to get a little mushroom head, and that's called the subcoronal area. And then below that you're going to see a little pink skin, and that's called the interpreputial skin. And then below that, then you're going to see kind of the penis skin, which looks similar to your skin on your arm or whatnot. And then after that, then you're going to get the skin that looks like your skin, or your scrotum. And so there's actually proportion to the penis. And so a lot of patient thinks that the penis is just a stick, and really it's not. And so there's a lot of misconception about that. And so if your child, or if you're an adult and you notice year after year the penis just doesn't change and it always looks like a belly button except when you have a little erection, then more than likely you have buried penis. Micropenis, which I won't touch into too much today because it deserves its own episode, is something that really there's not a lot of cure for. Micropenis just means that you're born with a tiny penis for life, and the only real treatment is to give testosterone within the first maybe 12 months to possibly 18 months, but the data is very sparse, and there's not a lot of good literature out there. So with micropenis, the prognosis is just not very good. Good thing is micropenis typically is associated with syndromes, and it's rare. And so chances are, if you Google hidden penis, Google always sensationalize stuff, right? More than likely what you're going to see is micropenis. The chance of you having that is going to be less than 1%. So I would, if I were banking on this and betting at, on at Vegas, I would more than likely go with hidden penis over micro penis. Now, so I hope that kind of helped clear up some of the misconception about, about this suprapubic pad and fat pad and then, growing into it. I mean, there's no such thing. Now, from the first 12 months to possibly 18 months, you do have a testosterone surge in children. And so you will notice that the penis kind of grows a little bit more than usual. And then after that, the penis kind of stays dormant until puberty, when testosterone starts circulating and all that. And so from, maybe at 12 months to 18 months, depending on which data set you believe, the penis will actually only grow a little bit each year. So don't be concerned if your child's penis isn't growing the way it is in puberty. And then, once puberty hits, then testosterone starts circulating, and that's what we refer to the Tanner stages. And then you'll notice the penis will just, and usually penis is genetically linked. So whatever dad size is, typically the kid size will be the same with some exception, nutrients and what I mean by that is, if you have poor nutrition, then just like with everything else, you probably won't grow as well. Versus if you have good nutrition, then you'll grow well. So just like my partner, who's also my younger brother, is 10 years younger than me, I'm 5'7" 3/4. He's 5'11", almost 5 feet, almost 6 feet. And same parents. The only difference is he was born here. And so I had rice milk, which probably has zero nutrition, versus he has whole milk, which has a lot of nutrition. And so that's why he's tall. As far as down there, I have no idea his length. So I never really asked him. But I do know, he is probably going to be different because of nutrition status. But now let's move on to the topics. So what is penis elongation? So penis elongation is when I physically, if you've already been circumcised, then, or if you're not circumcised, same difference. What I do is I make an incision below, usually about 2 centimeters below the subcoronal area or the head of the penis. And then what I do is you can actually peel the skin down like a banana. And basically what I do is I release all the tissue around the penis. And the penis really consists of just 2 cylinder and a urethra. And so what I do is, adults or children, I do this with magnification, which is kind of just a magnifying, we call it loops, but it's surgical loops, which the ones I wear magnifies 2.5, and then sometimes I'll wear 3, depending on the size of the penis. But what I do is I peel the skin down. I free up everything all the way to the penile-pubal ligament. Now, the old way of doing it, and I think people still do it, is they cut that penile-pubal ligament. I don't do that because what I found is that the length you get from that is maybe 0.5 centimeter resting, if even. But complication from that is it destabilizes the penis. And what I mean by that is the penile-pubal ligament actually, when you get an erection, it actually allows the penis to be stable and curve up. So there's a lot of data that's already shown if you cut the penile-pubal ligament, you're actually not going to get that much more length. To get more length, there's techniques that you do that, obviously I've been doing this for a while, and so, I'm not going to tell people how I do it, but there's way to get a longer penis without having to cut the penile-pubal ligament and cause the penis to be unstable. Because believe it or not, the hardest part about penis elongation is actually not bringing the penis out. I've done probably 14,000 cases since I started, because that's really all I do is kind of complex penile reconstruction, stuff like that. And what I've noticed is, there's just so many other ways you can get length, and the hardest part is actually skin coverage. And what I mean by that is a lot of patients that I see are actually circumcised, and so we'll start showing pictures so it'll make a little bit more sense. But if you pull the penis out and you've already been circumcised, where am I going to get that skin to cover the penis that's out? And that's always been the biggest issue. But through the years, we've come up with techniques to rotate skin around to give it still a natural look, so that basically, and that's the part that's the hardest. It's not bringing the penis out. Like literally, I can do that in 30 minutes. The hardest part is for me to figure out how am I going to cover the penis so that once it heals, it'll look, unless you told someone you had surgery, no one will ever know. And bear in mind that the first 6 weeks or so, it just depends on when the skin, when the skin starts stretching. You're not going to see an increase in the erection because skin is still very tense. And so basically, unless the erection is so strong that it tears the skin, you're not going to be able to, you will see an increase in resting length right after surgery. That's why all the surgeries we do, we always measure the actual length for the patient before the surgery and then after the surgery so that they can see. Like I did a gentleman recently, he was uncircumcised, and so he had all the skin in the world, and he started out, I think, at a resting length of 3.5, and after surgery was 9 inch, because he had a lot of skin to work with. And his penis was just really buried underneath there. And then I checked up on him couple months ago just to see how he was doing. And, I think it was probably around the 8-week mark where I asked him what was his erection length. He told me it was 10.5 now. And so you have to bear in mind that you won't see the erection length increase until the skin starts to stretch to accommodate the increase in, the penis being pulled out. But as far as resting length, you will notice that right away. And so that's elongation. Enlargement is when you physically try to do something to make the penis actually larger, not longer, but larger. And so as of right now, there's really only products on the market that accepted that, or that I would accept using if guys wish to have that done. And basically it's the gist of it is just like breast implant. It's just basically a silicone sheath that you kind of just insert around the 2-cylinder and the urethra of the penis. But when you do that, you have to make it match the size of the head of your penis or the gland's penis. Otherwise, it's going to look not right. Because just think about it. If you just come in and you want your girth to be like a beer can, but then your mushroom head looks like a pencil head, well, just envision that and see if that even looks sexy at all. The answer is no. So I actually don't have a lot of guys that ask to increase the girth. And so right now, there's a lot of commercials and, and doctors and stuff that are injecting fat and silicone and Lord know what else. I don't do any of that because those are all unreliable. Because what happened is when they inject it, what they're doing is they're injecting it underneath the skin. And so the penis is very mobile. And so every time you get an erection, the skin moves. And when it moves, it'll move whatever stuff that you inject, and you end up with what I call a lumpy penis. And so I've had guys have to come to ask to get it removed, and sometimes when you get it removed, it becomes a major undertaking because I have to sometimes take the skin with it because the skin is no longer viable. And so my suggestion is don't do it. And I don't know if you guys remember, but remember a few years ago, there was a French billionaire who basically died on the operating table. I forgot his name right now, but I just read it on the news. But he was getting a penis enlargement surgery, and they were, I think, injecting fat. He ended up with a pulmonary embolism. And so, because keep in mind, the penis is very vascular down there, and so anything can go wrong. And so there's a reason why you don't see true penis surgeon inject stuff in there. Usually people who inject stuff in there are not urologists because we know it's not durable. I have a patient coming up who basically had something injected, and I have no idea what it is. And when we try to request the medical record, the physician who had injected it had passed away. So, this was done years ago. And so now I have to kind of figure out what it is and then remove it. But it just from the pictures that was sent in, it doesn't look too bad. So I don't think that's going to be a big issue. Now, in terms of the complications, so really the biggest complication from surgery is not infertility, erectile dysfunction, none of that. The complication really boils down to skin breakdown. And skin breakdown from what? From erection. Because keep in mind that when I put your skin on stretch, that skin is on stretch all the way to accommodate the resting length. So when you have an erection, and if your erection is very strong, it can break the sutures. Now, we have ways to try to minimize all that, retention sutures and all that, and I think that really helps. But really, that's your main complication. Anything can happen, right? You can get into the urethra and all that, but personally, that's never happened to me. I do this regardless of age. I do it all under magnification, and I'm very meticulous when it comes to fixing these. And so, but like I said, the biggest issue is really, and then usually the biggest issue really is the pain. And so, I know a lot of guys, they're like, oh no, doc, don't worry about it. I've been shot, I've broken my rib, broken my wrist, all this. Personally, I never had it done, so I can't really give you a firsthand experience. But just from what I heard from patients, it's painful when you get an erection, but of course it goes away, and usually about 7 to 10 days. And so what I always tell guys, so guys that are not circumcised, they will tend to have less pain because they have all the skin in the world for me to work with. And so basically, if they have enough skin where I can make it a little bit loose to accommodate the erection, then they tend to do well. And so but the issue is a lot of guys who come in for this, they have already been circumcised, and so it was a misdiagnosis where they had buried penis. So instead of sending it to a surgeon to properly fix it, they just end up getting a circumcision, and then they come in because they can't see their penis. Like I had one guy that literally has not seen his penis for, I think, 15 years because it was that sunken in. And so it's a serious disease, and it's nothing to be embarrassed about. And so, what I always counsel patients is they really need to think about, do they want the full stretch, which means the longest length possible? Because if you do that, then you're gonna you're gonna have a little bit more pain for a few more days. Versus guys that go like, that tell me, okay, doc, I'll go ahead and agree to have it 1.5 inches shorter so that I have enough skin to accommodate the erection. Personally, I've never had a patient that has agreed to that, but I always counsel and document that so that patients, fully understand. And as far as patient satisfaction, to be honest with you, pretty much is almost 100%. Once they, kind of like Navy SEAL training Bud Week, right? This is penis healing week, and so it hurts. I'm not, like I said, I never personally experienced it, but it hurts. And so if you're able to withstand the pain, and which obviously thousands of guys have, and then the younger you are, the easier the recovery. But no guy has ever wanted to trade in their 22 caliber for a 9mm. They all want to come out with a Magnum 44, which is fine, but I tell them, just think about it, and on the day of surgery, give me a thumbs up or thumbs down. Thumbs down means that, okay, I'm going to make your penis a little bit shorter to accommodate for your erection. And then thumbs up means that, go all the way. And so as of today, I have had 0 patient that has decided to not go all the way. And so basically, so now I hopefully with this, people are more educated now on what penis elongation is versus penis enlargement. And as of right now, I do not recommend any sort of fat injection, silicone injection, any sort of injection, because all you're going to do is you're asking for trouble. You inject fat, you risk pulmonary embolism. You inject silicone, you risk infection because that's a foreign body, right? Versus when I do the penile surgery, there's really no foreign body with the exception of the sutures. But the sutures is tried and true. And so it's non-reactive. And I've never had to remove a suture because of infection ever before. And so now, what happened if you get a skin breakdown? Rarely do I ever have to take you back to debride it or anything like that. Typically, when you get a wound breakdown, I just apply collagen, which help form a scaffold, and your skin will then heal around it. And so, and typically, I have patients refrain from adult activities for about 6 weeks. And then obviously, if they have a wound breakdown, then obviously we wait a little bit better. But I think now with kind of the newer techniques that we implemented, I'm seeing less and less of wound breakdown. And wound breakdown in my patient population is only about 1%. If you can have like a tiny little breakdown that'll just heal in a few days. When I talk about wound breakdown, I'm talking about like the major wound breakdown where the erection is so strong that it just tears up the whole suture line. But once I implemented some of the techniques that we have, I personally have never seen the wound breakdown. And so normally after surgery, we just give 5 days of antibiotics and pain meds, and then they just kind of manage the pain until roughly around 7 to 10 days. And this is usually for guys that are uncircumcised. That are circumcised. Guys that are uncircumcised, they tend to do a little bit better because they do have more skin that allow me to give it room for it to accommodate the erection. And even in those guys, they're still going to see an increase in erection length because the skin is still going to stretch. And so hopefully this episode kind of clear up all this misconception of growing into it. I don't know what that even means. So if you're worried about it, if the penis just looks like a belly button all the time, or you don't even see it. A new word that I learned from one of the teenagers, a mangina. If you see something like that, then best thing to do is just seek a professional opinion, and because you got nothing to lose, right? And keep in mind, a lot of these I fix when they're young, 3 or 4 months. But those are kids that have already been diagnosed and they've been sent to me. So hidden penis is a very nuanced thing to diagnose. And so the best thing to do is probably just have a professional look at it. And my thoughts is you should always get second opinion, third opinion, fourth opinion, fifth opinion, as many opinions you want, because at the end of the day, it is your body and you're the one who's going to have to undergo the surgery if you choose the surgery. So always do your research. And then from there, you'll know what you need to do. So hopefully this episode kind of clears up that misconception, and a little bit, people are now a little bit educated more on the difference between elongation versus enlargement, and kind of how it's done, and the recovery, and stuff like that. And then in my hands, success rate is pretty much almost 100%. And it just has to do with the technique we use. Usually I just see them back in 4 months, make sure they do okay. And then with the adults, I see them back in 6 weeks because they want to be cleared so that they can, it's like a shiny Ferrari, right? You wanted to take it out to use it, but you got to have a break-in period. So that 6 week is considered the break-in period. And then after that, do whatever you want, show it off, ram it, race it, do whatever you want. It doesn't matter. So hopefully this has been an educational podcast. And then there's a topic that you specifically want, feel free to message me. And then to search for my podcast, it's called D-Talk with Dr. Pham. This is Dr. Pham.
We gon' do it like it's priceless. Take it to the moon. Priceless. One day will be soon. Like it's priceless.